So Jane, it appears certainly in the US, we've solved the caloric crisis, but we did that by supplementing our diet with manufactured carbohydrates. That was our solution, stripped down carbohydrates. And now from a health perspective, you're taking this stripped down carbohydrate and throwing a bunch of additives in and marketing as being healthy. How do we, in a developing world where hunger is still an issue, where access in our local environments is still an issue, how do we modify that? And really the problems are not just what we're eating, what is globally available as an abundant food source, but it's how do we get that into the communities where access is an issue? We call that food deserts over here. How do we help people to budget and cost? Because nobody on this panel is not poor. And how do we help someone on a limited budget to eat this way, whether it's carnivore, whether it's vegetable-based? How do we store that food? It's easy to store a bag of chips on the shelf. How do we store vegetables? How do we store meat? And how do we prepare it? So there are multiple issues at a societal level that are far broader than just, oh, this is a healthy way to go. What are your thoughts on that, Jayne?
So, if we look at America and South Africa, two of the least healthy countries in the world. So I think you're number one at the moment. We were around number 3. So yes, we have malnutrition, we have hunger here, but we have unprecedented levels of diabetes, obesity, and massive health problems. You have reversed hunger. You don't have hungry, empty bellies in America, but you have even worse problems. So it's a very, very difficult position that policymakers are in. It's like, do we fill tummies and potentially kill people further down the line and have that immense strain on healthcare 10, 20 years later? Or do we kind of figure out other solutions? Well, in South Africa, it's obvious. So, I mean, when we go and we talk to governments about how to get kids to eat low carb diets, a lot of the time they laugh at us and they say, it's a choice for us. These children don't eat over weekends because their parents aren't able to afford them. So if we can give them a bread roll, it's better than nothing. And how do you disagree with that? It's a very, very difficult situation that policymakers are in. There isn't enough resources to feed every stomach in our country. So, it's certainly not healthily. So the dichotomy between children that are privileged, my child eats a very high protein diet, Hasina's kids eat an incredibly healthy diet, they're lucky. There's a child in the township down the road from us that isn't getting food from day to day unless somebody gives them a stale bread roll turned into slop, which is one of the feeding programs we've worked with in the past. They take secondhand bread that's like day old that retail outlets donate to them, and they mush it into a slop and plump it onto a plate and give it to kids, and that keeps them from dying of hunger. So it's an incredibly difficult one, and we cannot judge that. But what we do know in South Africa, we're the number 1 producer of macadamia nuts in the world, and only about 2% of those nuts stay in our borders. They're all shipped, they're exported, and they're sold mostly in China and America. So we have an unbelievably resourced country, and we're not getting access to the food. I had the best blueberries I've ever had in my life last time I was in San Diego, and I looked around to the bottom of the box. I was like, I can't believe, where does this come from? And it said South Africa. And I felt cheated, So there's systemic problems in the way that policy is done at the moment, and in the way that we agree to provide food to our own nation, certainly as a country in South Africa. And in America, what's happening is there's an overfeeding problem, and you're getting the wrong calories in the wrong ways. And what I see this being a problem of is the agreement of scientific communities. So what I don't want, if we're looking into the future, into the next 50 years, I don't want our next generations to point back at us the way that we do at Ansel Keys and his peers and say, like, they were so busy squabbling over the little thing here that they were ignoring the elephant in the room, which are the big, broad brushstrokes. What is it that we agree on that is not healthy for human health? And how do we go, okay, we're not going to fight over keto versus vegan versus, how many micrograms of carbs there should be in a diet, but actually what should we change systemically so that the next generation is eating healthy food, or at least has access to live a vaguely decent life, because at the moment, what we're eating and what we're being fed and told is healthy is robbing us of a quality of life and even actually, the outlook of a long life at this point. So we've got a number of things as a community that we have to address. And we have to find a way to get over ourselves and over our own need to be right and to have these conversations. So the vision for the World Nutrition Summit this year is exactly that. We're trying to go, this isn't about what diet exactly, the micronutrients. It's about figuring out what the broad brushstrokes are. What are the huge issues? How can we societally actually agree on certain things and then work together in a direction towards, in 20 years' time, how are those kids sitting in a township that don't have access to healthy food going to get a fresh amount of food into their diets? It's a huge, it takes everyone. It's not about the medical community or scientific community agreeing. It's about retail being involved. It's about the pharmaceutical industry being involved to some extent. Everyone's in on this.